1 in 9 Indians is vulnerable to cancer, but early detection can save lives. Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.
Hello and a very warm welcome to a special presentation of Sanjeevani United Against Cancer, where we are raising awareness around cancer and promoting the early detection of the disease. The word cancer strikes fear amongst all of us, but with early detection and timely treatment, it can be defeated. Today we have brought together a stellar panel of doctors to delve into crucial aspects of cancer care in India. And it is my honor to welcome Dr. Megha Pruthi, Additional Director NHOD Pain and Palliative Medicine Fortis, Dr. Nitesh Rohtagi, Senior Director Medical Oncology Fortis, Dr. Vikas Dua, Principal Director Pediatric Hematology, Oncology and BMT Fortis, and Dr. Anil Kumar Anand, Senior Director Radiation Oncology Fortis. First of all, thank you so much for taking out time, because I know how busy each one of you is in your schedules, and for all the wonderful job that you do with patients, giving them hope, and obviously the much needed treatment that is required in these days, because it seems cancer is on a rise. And Dr. Nitesh, why are we hearing of so many cases about cancer and different types of cancer? So I first want to know, it is on a rise. Which part of the body are they affecting or targeting the most? And why India? Is it just because we are populated so our numbers are high, or are we in a geographical and a genetic predisposition for cancer?
First of all, let's accept first point. It is on the rise. Okay. Your question was very interesting, which is which part of the body? And the stunning, not so nice news is all parts of the body. So in fact, we are clearly seeing an upward trend in India especially of all cancers increasing. Without having much evidence, we are seeing maybe colon cancer is increasing a bit rapidly. We don't really know the causation because we've not invested enough time and effort in looking at the cause for cancers in India as compared to the West, where most of the data is coming from.
Right.
What is really stunning though is we are seeing an upward and a sharp upward rise in young age cancers. We are seeing a breast cancer rise under 50s, a colon cancer rise under 15, a gallbladder, a liver cancer rise under 50s, lung cancer rise under 15, lung cancer rise in non-smokers in India.
Yes.
And these figures are genuinely very startling and worrisome. Why? And there's no clear answer. Lost of postulations, we are living longer for sure.
Right.
We are living in a very polluted environment for sure. But clearly the World Health Organization has put forward alcohol, smoking, lack of exercise, obesity are the key factors, including the processed red meat. So if we can get rid of these 5, diet, exercise, processed red meat, and alcohol smoking, I think we will see a change in trend.
Dr. Vikas, with children, none of these reasons can play any role. Yet we are seeing pediatric cancer on a rise. Why is that happening?
Undoubtedly, pediatric cancers are also on a rise. We don't know why cancer happens in pediatric age group, because 99% patients, they don't have a cause. It's idiopathic. In just 1% patients, there can be a genetic predisposition. But probably the reason of having more cancers we are seeing nowadays is we have more better diagnostic facilities. We have more pediatric oncologists in the country. I would say more qualified pediatric oncologists in the country. That's why they're picking these cancers early, and that's why we are seeing these cancers more.
I think with children, we can easily say that the concentration is on cure and having them completely free. Early detection also is very pivotal in pediatric cancer, but a lot of times parents don't naturally think that the child may have a disease like that. So what is that period, or what are those symptoms that should not be ignored when we are talking about early detection in children?
Okay, so the parents need to be intolerant to the child's symptoms. When I say that, the most common cancer which happens in pediatric age group is blood cancer, fever, bleeding spots, low hemoglobin, weakness. If your child has been having fever for a long time, you're not able to find an answer to that. meet a correct person, meet a pediatric oncologist. If a child has got bleeding spots over the body, if the child is looking pale, is weak, meet a pediatric oncologist, because he may be able to pick those things. He may be able to say whether it is cancer or not. In a similar way, the second most common, which majority of people don't know, is brain tumor. So if a child has been having headache, has been having some gait instability, some visual disturbances, is been complaining of pain when he gets up in the morning, is vomiting in the morning, and you have met a pediatrician and you've not been able to find a solution, better meet a pediatric oncologist or meet a pediatric neurologist who may advise a scan, and then you may pick brain cancer early.
If I may very briefly add,
Sure.
the guru mantra there is, if you have a new symptom, it's escalating and it's been 4 to 6 weeks, go and ask your doctor, could this be cancer? I said, know your body well. And if it's still saying no, then go to another doctor and say, could this be cancer?
Right.
But if it's new, if it's escalating, it's been 6 weeks, don't ignore it.
Dr. Anand, now we know cancer is on a rise. We also know we may have a predisposition. Under 50, there are so many things that Sir also mentioned about lifestyle instances, but everybody seems to be socially drinking, socially smoking, eating all kinds of meats, etc. In terms of prevention, in terms of treatment, and in terms of watching our own symptoms, what is it that people need to know? Because everybody seems to feel that it will happen to somebody else, but not to me.
Yeah, I think that is a very important observation, that we think cancer is somebody else's disease. But I think that the important thing is that I see now a lot of younger generation is taking up physical exercise, going to gym. So we see some change. I think same kind of change has to occur in the population towards our living lifestyle. For example, we have now late nights and junk food and smoking, drinking. I think we have to have programs like this to put more awareness into people that cancer is also related. Cancer is seen more in obese people, seen, as for example, breast cancer is seen more in obese people, people who marry very late. Prostate cancer is also more obesity related. Colon cancer is also obesity related. So if we know that other heart diseases and other diseases, diabetes capital of India is a diabetic capital of the world. So similarly, cancer also is somewhat related there also, that the lifestyle change is making you prone for diabetes, is making you prone for cancer also. So it's going side by side, and I think we have to keep an eye on that. But I think one silver lining I want to add, acting on these things helps. And one of the greatest example which India has also seen is drop in cancer cervix. And the good news is the cancer of cervix has dropped considerably, less than half than what we used to see 20 years back. And also we are seeing early cases. So this is a silver lining. Other thing in cancer cervix has happened, vaccine.
Right.
So we talked of vaccine in COVID time. So people are now convinced vaccine helps. Previously, there was a taboo. No, vaccine may help, it may not help, it may be harmful. But if you give vaccine at the early age of 10 to 12 years, you can virtually eliminate cancer of the cervix.
Right. So can you elaborate on the Moonshot program?
It is more of a Western kind of concept, which is very good, according to me. And what it says, they pool in the efforts. So we pool in all our
Holistic.
efforts. In research, in collaboration, we share our data. For example, we say particular type of lung cancer is more common in India, then we have to report it, because
Right.
few of the drugs are just acting against a particular molecular type of cancer. So if we have that data in India, we will do more on discovery of those drugs. So I think Moonshot is a way to stimulate us, to prod us to do more and do quickly.
Dr. Megha, I have to say that cancer is still cancer.
I agree.
You cannot say you defeat cancer. You get defeated in the process also. You meet so many patients who know that there is that milestone which I'll reach after my radiation sessions and chemo. I have to finish those many chemo sittings and then things will start getting better. But till you reach that, it breaks your spirit with a lot of things. But Now we are talking about interventions that can make that journey easier. Should there be now a change in palliative medicine's definition? People usually think of palliative as something which is at the fag end, right? But should it change in a way that it helps recovering patients as well? How does that happen with pain management as well?
So palliation is a beautiful word, and I really don't want to change the word. Pallia means cloak. It means to care. It means to protect.
Right.
So palliative care in itself means that it is providing you an extra layer of support while you are ongoing your cancer-directed treatment. When you just get diagnosed, I mean, that's a heart-shattering moment, not just for the patient, it's for the entire family.
Right.
It shatters the entire family. So I think your oncologists, they remain your first palliative care physicians. So how they break the news to the patient. So while the patient is ongoing their treatments, they can have a lot of pain. They can undergo a lot of nausea, vomiting, constipation, diarrhea, and breathlessness, and restlessness, and anxiety, and sadness. So you name it, and they have those symptoms, right? So palliative care will help you. So symptom management majorly is the heart of palliative care, right?
Yeah.
My medication would not have any effect on your cancer. It will not increase it, it will not decrease it, right? All palliative care medications would be focusing on your quality of life. So when palliative care gets merged with oncological care early on in life, patients' quality of life improves, their symptoms are better managed, they have kind of a safe place, So it's kind of a holistic umbrella approach. And where it's always a team, right? It's a physician, it's a nurse, it's a psychologist, a nutritionist, everybody, a physiotherapist. Everybody comes together under that umbrella to help the patient and the caregivers. I feel caregivers are the unsung heroes there. And so in palliative care, caregivers' support is to the heart of it. And we help them, take care, asking them, have they eaten their food? Have they been sleeping well? So I think that's what palliative care does.
Wonderful. We just have to take a short break here, but when we come back on this special episode of Sanjeevani United Against Cancer, we'll talk about the modern interventions and what technology is doing in this space. So stay tuned.
1 in 9 Indians is vulnerable to cancer, but early detection can save lives. Federal Bank and News 18 Network present Sanjeevani United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.
Welcome back to this special episode of Sanjeevani United Against Cancer, where we are discussing the nuances of cancer care in India with my esteemed panel of medical experts. What are some of the new age technologies that have come and that everybody should know about?
One part of technology is early diagnosis, more precise diagnosis of the cancer. And the second part is that unfortunately, if somebody is detected with cancer, how best to treat him. And the meaning is, best means high cure with minimum side effects, minimum morbidity, and minimal effect on quality of life. For example, if we can say some patient is diagnosed with early stage lung cancer. Now, the early stage lung cancer usual treatment is doing surgery. So we have evolved a lot on surgery, VATS, lobectomy, and robotic surgery. So this is a new technology, and the patient gets surgery and he gets home third day. Similarly, the radiation oncology has evolved a lot. Now we have equipment where the main job is to treat a cancer with as high precision as possible so that we give highest possible dose with virtually no side effect. Our focus and the focus of technology is giving high cures with minimum side effects and minimum adverse effect on quality of life.
Great, sir. Dr. Vikas, taking the same thread forward, when we talk about pediatric treatments, how pain-free can they be, and with modern technology, is that possible, and has it also shortened the time of treatment?
Oh yes, I think in general what Dr. Anand said holds true for pediatric population also. So when it comes to pediatric population, I would say that the two most common cancers which we see in our practice, blood cancers and brain tumors. So in blood cancer, there was a time when we used to say that this is the chemotherapy which is available. But now we can tell the family at the first go whether the cancer which the child has is good, bad or ugly. So in a technical way, you can say whether it's a standard risk, intermediate risk or high risk,
Right.
so that you can plan the therapy, you can counsel the family accordingly. In a similar way, the second most common cancer, which is brain tumors. So previously, people who were less than 6 years, 10 years were getting radiation therapy. And we all know the fact that if radiation is given to somebody who's been growing age, then it can cause harm. So nowadays we have protocols, we have therapies with which you can avoid radiation. You can pick up a target and you can give targeted therapy to that patient, which can give a cure to these patients. So definitely in pediatric oncology, a lot of advances have happened.
Wonderful. It all comes down, Dr. Nitesh, to getting the treatment at the right time, nabbing the C word at the right time. But there are no concentrated cancer screening tests. You know, if I have a heart issue, if I go, even if I don't have a heart issue, but you know, there are so many screening programs and so many health checkups that I can do to figure if my organs are fine, but there's nothing like that for an early detection of say, cancer. What should both men and women be concentrating on tests-wise, at what age, to ensure that their bodies are fit and fine and they are likely not to have cancer?
So we'll answer that in 3 ways. One, what we call red flag signs,
Right.
which is know your body well.
Okay.
And if there is a problem, go to a doctor. If he refuses, go back to a doctor. A red flag sign could be a lump. A red flag sign could be a blood in a vomit or blood in a coughing. A red flag sign could be a fever which is not abating. A red flag sign could be a weight loss more than 10 kilos.
Oh.
And these are available. If you just Google red flag signs for cancer, you'll see a table with a list.
Right.
If you get them, if they are increasing and they are not solving, again 6 weeks, Guru Mantra, please go and ask your doctor, could this be cancer? You will detect cancer earlier by doing that. And I'll again say they're not all cancers, but these are red flag signs. The second is the screening programs.
True.
We do know for breast cancer with family history, starting at least an ultrasound breast at 40 on a yearly basis is useful for detecting cancer early. And that family history doesn't have to be literally your mother or sister, even if it's slightly distant family history, a masi, a mama, of prostate cancer, ovarian cancer, breast cancer, other pancreatic cancers. Be on the alert. And at 50, all women should undergo breast cancer screening, cervical cancer vaccine and screening. Vaccine between 10 to 13 for women, and we'll soon be talking about men as well, because we know it prevents HPV infection, and it is the HPV infection which causes cancer, and we have already seen in the West the rates go down. But it does not stop you still from screening with a simple pap smear, simplest test done 3 to 5 years. Same way, colon cancer. People are surprised, but it is important to do colonoscopy at 50 and once in 5 years. If you have a polyp, do it every year, because polyp is often, if not sometimes, a pre-cancer stage. Take it out during colonoscopy, the cancer won't happen.
Doctor, this is going to be a tough question. Not all outcomes of cancer are positive. What can palliative care offer then? What do patients and the families do when they know this is not going to get cured?
I know. So, you know, in India, 70 to 80% of cancer are still being diagnosed in stage 3 and 4, which is not the curable stage for a solid cancer. In, you know, pediatric, they can be sometimes curable. So I feel, you know, palliative care is important at 3 stages of cancer. The first is when the symptoms are overwhelming. The second is when, you know, we are getting a cancer-directed treatment, but the disease is progressing. And the third would be when your oncologist says that, you know, we do not have anything more in terms of curative therapies to offer, right? So in palliative care, the dictum is very simple. There's always something that we can do for a person with cancer, right? So if we cannot offer cure, we can always offer care for those patients.
Pain management.
So pain, cancer sometimes is synonymous with pain, and even in our well-educated people, they think that now, they have cancer, they will have to suffer and they will have to, die in pain. So that's not the truth. So, if the cancer becomes incurable at some point, and so there can be symptoms, pain, nausea, vomiting, constipation, diarrhea, breathlessness, restlessness, and all these symptoms are at least 70 to 80% manageable with the best of palliative medicine. Dying with dignity, they have lived all their life with dignity, and then at the end of it, if they are into ICUs and, with that tubes inserted all over their, wherever there it is possible. So I think that's not a requirement. They can really be taken care at home. They can be taken care in the hospital if the resources for home care are not available. So, and we can really make the exit very, very dignified. It's very important for the awareness to happen,
It's a right.
Yes,
there's right to live, there's
also right to
dignified
die
death.
with
Absolutely.
dignity.
Well, thank you so much for this very elaborate panel that we put together for our viewers, and all of you gave your inputs, and for your time. I'm so grateful. Thank you so much.
Thank you so much. Thank you.
And viewers, remember that early detection can save lives. So, yaad rakhe, screen kare. Thanks for watching this special episode of Sanjeevani United Against Cancer.
1 in 9 Indians is vulnerable to cancer, but early detection can save lives. Federal Bank and News 18 Network present Sanjeevani United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.